Today's topic is about lead poisoning. Surprisingly, lead is present in so many contents or things surrounding us. So, in detail, the main sources for this lead poisoning that we will look. So, first, that lead is the most common environmental poison in India. About 30% of population are already affected by this lead poisoning. It is dispersed into air, water, soil, and food as well as lead poisoning is also included in the class of summer disease as increased temperature which is in the summer brings out the dust and lead particles will also increase in the air. Paint is the major source for exposure, especially in the children as they bite painted toys. So they have tendency to put toys in their mouth, particularly younger childs. US law states that paints should not contain more than 0.06% of lead, but Indian paints, especially cheaper ones, may contain up to 30% lead salts. Further, paint is peeled off as small flakes from walls of the living rooms, and sometimes young childs put that small flakes in their mouth, and that is one of the source for the lead poisoning. Increased content of lead is seen in air, water and vegetables in cities and near highways. This is due to the tetraethyl lead derived from the exhaust of vehicle because that lead containing petrol is present in the vehicle. So use of lead free petrol has reduced this type of contamination. Lead pipes are important source for contamination. So in older days lead pipes are utilized for the transportation and as well as for the normal plumbing work, but nowadays lead pipes are very less in use. Newspaper and Xerox copy contains lead which is absorbed to fingertips and later contaminate foodstuff taken by hands. Simple, so many food which are sold in a street are served on a newspaper or the waste Xerox copies. So they are containing some amount of the lead and that can create some poisoning effect. Further, one pack of cigarette contains 15 microgram of lead and chronic smoker have higher blood level of a lead. So simple that cigarette, one pack of cigarette contains 15 microgram of the lead. Further, lead chromate is commonly used as adulterant in curcumin, particularly in the haldi because of the similar nature of the color. Battery repair, radiator repair, soldering, painting and printing are occupations prone to get lead poisoning. So that all batteries which are the waste batteries sometimes they can contaminated air, water and soil also. Now, one interesting story related to this lead poisoning. A 65-year-old male was admitted with typical symptoms of encephalopathy, nephropathy, and anemia. The lead level in blood was over 100 milligram per deciliter. On detailed questioning, the patient told that he was very particular to take only pure food and he was preparing fresh wet flour. So he was powdering wheat on a small hand mill at his house. The machine had a crusher which was fixed on the pivot by soldering with the lead. So every time when wet flour that is crushed, during that time some lead that is enter in that flour. So for the last 30 years he was getting daily doses of lead along with his pure atta. So the company had already supplied thousands of such instruments throughout the country. So all those family might be getting harmful doses of lead slow by slow on daily basis. So that should be taken care. Sign and symptoms of that lead poisoning. Lead is a cumulative poison and is accumulated in tissue over the year. It is not biodegradable. 90% of lead is seen in bones, 9% in blood and 1% in brain and kidney. More than 10 milligram per deciliter in children and more than 25 milligram per deciliter in adults leads to the toxic manifestation. So miscarriage, stillbirth and premature birth are reported in lead poisoning for mothers. So in children, mental retardation, learning disability, behavior problems, hyperexcitability and seizures are also seen. Even small amount for long time will reduce IQ to the 8 point. Further, you have to remember lead particularly inhibit delta ALA, that is delta aminolevulinic acid synthase enzyme, as well as ALA dehydrogenase. So these two are the starting for the heme synthesis, and last enzyme for this heme synthesis, that is ferrochelatase. So all these are inhibited by this lead, and that is leading to the anemia formation. So when lead is present in the blood, it is overall reduced lifespan of the red blood cell. Anemia, abdominal colic, and loss of appetite is also common with this lead poisoning. Anemia enhances lead absorption, but lead inhibit iron and calcium absorption. So there is a vicious cycle will be continue. Basophilic stippling of red blood cell is seen in peripheral smear of blood as well as in the bone marrow. So this type of stippling that is seen when there is a lead poisoning. Further, if the blood level is more than 70 mg per deciliter, acute toxicity as encephalopathy, convulsion, mania, neuropathy, abdominal colic, severe anemia, and kidney damage is also seen. Discoloration and blue line along the gums are characteristic feature of the acute lead poisoning. Sometimes it is also asked, when blue line along the gums is seen, which type of poisoning? You have to remember that lead poisoning, that is showing blue line along the gums. Further, treatment of this lead poisoning, you have to remember that calcium dodecyl edetate, calcium disodium worsenate, or penicillamine, as well as dimercaprol, that is called a British anti-Lewisite. Dimercaptosuccinic acid or succinate is a better but costly antidote for this lead poisoning. So that's all about the lead poisoning sources, signs, symptoms, and treatment.